Hi friends, after a short break, I am in front of you to continue the classes. Once again, a warm welcome to my YouTube channel, Future Midwife. Today, we will discuss about one of the amniotic fluid disorders during pregnancy. Yes, I think you got the topic. It is hydramnios. When we heard about the hydramnios, we know there are two conditions, that is polyhydramnios and oligohydramnios. So today we will discuss about oligohydramnios in detail. Before moving to the topic oligohydramnia in detail, I would like to say the significance of amniotic fluid during pregnancy. As you all know, it's a clear yellowish fluid which is present inside the amniotic sac, which always protect the growing fetus. Also, it aids for the proper development of growing fetus during pregnancy. Its pH value is 7.2 and the specific gravity is ranges between 1.0069 to 1.008. The normal amniotic fluid volume ranges between 500 to 1000 ml at 10. So, in case of oligohydramnia, the amniotic fluid volume will be less than 500 ml. So, when it consider the amniotic fluid index, it also varies according to the gestational age. Here, in case of oligohydramnias, the amniotic fluid index will be less than 5 centimeter, or the deepest vertical pool will be less than 2 centimeter. First, we'll see the definition of oligohydramnios. Oligohydramnia is a condition characterized by decreased amniotic fluid volume for gestational age, often arising from maternal, fetal, or placental complication. This condition can be associated with a poor fetal outcome, including impaired lung development, growth restriction, and increased risk of labor complication. Here we'll discuss about the causes or etiology of oligohydramnios, which can be categorized into many ways. The first one is maternal factors. The maternal factors include hypertensive disorders such as preeclampsia and chronic hypertension, dehydration during pregnancy, and uteroplacental insufficiency. When it comes to the fetal factors, which include renal agenesis, example Porter syndrome, urinary tract obstruction, and chromosomal abnormalities. When it comes to the placental factors, which include placental abruption, postpartum pregnancy, that is more than 42 weeks, and twin-to-twin transfusion syndrome, especially in case of monochorionic twins. Other causes include premature rupture of membrane and certain medications such as ACE inhibitors and NSAIDs used during pregnancy. So these are the etiology of oligohydramnios. Here we'll discuss about the classification of oligohydramnios. The oligohydramnia can be classified according to the value of amniotic fluid index. According to that, it can be categorized into three: mild oligohydramnia, moderate oligohydramnia, and severe oligohydramnia. In case of mild oligohydramnia, amniotic fluid index will be 5 to 8 centimeter. In case of moderate oligohydramnias, the amniotic fluid index will be between 2.5 to 5 centimeter. So whereas in case of severe oligohydramnia, the amniotic fluid index will be less than 2.5 centimeter. Now I will discuss about the signs and symptoms of oligohydramnios. The first one is maternal symptom. In that, the first one is decreased fetal movement. Women may notice less fetal movement due to decreased amniotic fluid. The second one is uterine contraction. Increased uterine contraction can occur due to decreased amniotic fluid. The third one is abdominal discomfort. Women may experience abdominal discomfort or tightness. When it comes to the fetal symptoms, the first one is growth restriction. Oligohydramnia can lead to fetal growth restriction. The second one will be clubfoot or other deformities. Decreased amniotic fluid can cause fetal limbs to become compressed or leading to deformities. The third one is pulmonary hypoplasia. Underdeveloped lungs due to decreased amniotic fluid. Next is the ultrasound signs. That first one is decreased amniotic fluid volume. The second one is fetal crowding. Fetus appears crowded due to decreased amniotic fluid. The third one is fetal echogenic bowel. Bowel appears more echogenic due to decreased amniotic fluid. The other symptoms are low fetal weight, meconium stained amniotic fluid, and abnormal fetal heart rate. So these are the signs and symptoms of oligohydramnios. Next is the diagnostic measures of oligohydramnia. Oligohydramnia can be diagnosed by ultrasound. In that we can identify the amniotic fluid index, which is less than 5 cm, and the deepest vertical pool will be less than 2 cm. Apart from that, we can use other diagnostic measures such as NST, biophysical profile, and Doppler. So in case of NST, we can identify the fetal heart rate in corresponds to the fetal movement. In case of biophysical profile, we can identify the fetal well-being with the help of ultrasound and NST. And the last one is Doppler, which I said that can be identify the blood flow to the umbilical cord. Here we reach the management of oligohydramnia. The management of oligohydramnia can be decided depending upon the severity of oligohydramnia and the gestational age. So depending upon the gestational age, the management also vary. So here we will discuss about the different managements of oligohydramnia. The management plan for oligohydramnias are divided into many headings. The first one is initial assessment. The initial assessment include the first one is confirm diagnosis. Verify oligohydramnios diagnosis using ultrasound or maximum vertical pocket. The second one is gestational age. So determine the gestational age to guide management decision. The third one is fetal well-being. Assess the fetal well-being using non-stress test, biophysical profile, and Doppler ultrasound. The second management include maternal management. These are hydration. So encourage maternal hydration to increase amniotic fluid level. Next one is rest. Advise the mother to take sufficient rest in order to reduce the uterine contraction. The third one is regular monitoring of maternal blood pressure, urine output, and fetal well-being. Next is the fetal management. In that, first one is fetal movement monitoring. Instruct the mother to monitor fetal movement and report any decrease. The next is non-stress test. Perform regular non-stress test to assess fetal well-being. Next one is biophysical profile. It should be conducted regularly in order to identify the fetal well-being. The last one is Doppler ultrasound. Use Doppler ultrasound to monitor the fetal blood flow. The intervention management include amnio infusion. That means infusion of saline or lactated Ringer's solution into the amniotic cavity to increase fluid level. The next is the corticosteroid. Administer corticosteroid to promote fetal lung maturity. The delivery management include time of the delivery. That means determine the optimal timing of delivery based on gestational age, fetal well-being, and maternal health. Last is the mode of delivery. Decide on the mode of delivery, that means vaginal or cesarean, based on fetal well-being, maternal health, and obstetrical indications. So these are the management of oligohydramnia. Here we can wind up our today's topic. I hope all of you understood about the oligohydramnia. It is a simple topic. Here I explained the definition, signs and symptoms, etiology, diagnostic measures, and management. The complications of oligohydramnias will be displayed on the slide. Please have a look on it. So in the next class we will meet with another episode of midwifery topic. Till that, take care. Bye bye.